I've known Dr. Reddy since college. He happens to be my husband's best friend as well, and also a internal medicine physician here at UCSF. The other hat he wears is with our Osher Center, which is our integrative medicine center, and we've been able to collaborate on a couple projects with integrating complementary and alternative medicine into bladder cancer care. So he actually was jointly seeing patients with me with bladder cancer, both muscle invasive and non-muscle invasive. And I think got a really good appreciation and understanding from a patient's perspective, what some of the things that I recommended for treatment really meant to a patient from this whole more holistic perspective. And so, Andrea, do you mind playing the video now? Sanjay said, okay, or did you want to?
Actually, you know what I was thinking? Since it's a smaller group without Barrage, I might just do the talk live, if that's okay, and share my screen. And if there's problems,
That's
we can
totally fine. Yeah, let's do it.
And then we can just talk as we go.
Perfect. So you're just going to share your screen? That's fine.
Yeah.
Okay.
Thanks, Andrea.
Okay, assuming I can figure out how to do this again. Give me 1 second. Sorry. Great. Sorry, everyone. Okay. And I think. Okay. Is this coming through okay?
Yeah, it's coming through fine.
Okay, so hi everyone. As Seema said, I'm Sanjay Reddy. I'm one of the doctors at UCSF, and I do a combination of internal medicine and integrative medicine. And we did this joint clinic together. That was a great thing we were able to do, where it was covered by insurance, and we were both able to see people at the same time. And kind of, Dr. Porn would go through their uro-oncologic plan, and then I would talk to them after about symptom management and using some of the tools from integrative medicine. So just a quick roadmap of kind of what we're going to talk about. And at any point in time, if you want to talk about something more, we can stop and discuss it. I've made this talk pretty evidence-based, so for almost everything, the conclusion is that we need more evidence, we need more studies. But we're going to talk about diet, probiotics, herbs and supplements, exercise, yoga, acupuncture, mind body, a little bit about aromatherapy, medical cannabis, and psychedelics. And so with diet, so we spent a lot of our clinic talking about diet, and with other cancers, there's a fair amount of links of associations between dietary intake and then risk of developing cancer or recurrence of cancer. So unfortunately with bladder, well, unfortunately from my standpoint, there was a study in 2019 that came out in bladder cancer that looked at almost 180,000 women in a nurse's health study, and then 45,000 men in another health professional study. And they had about 5 million person years of observations and 1,000 incidences of bladder cancer during that time. They made this scale where they took 18 different food groups, and they kind of ranked them based on how inflammatory they were and gave them a weighted score. And then they come up based on the person's diet of how inflammatory their diet is or not. And they didn't find in bladder cancer specifically an associated risk in bladder cancer for any group, regardless of their smoking status. This study came out after we finished doing our joint clinic. So we didn't have a chance to figure out how this would have impacted our recommendations. But so for bladder cancer, this is not a huge, I mean, it's a lot of people, but it's not a lot of people with bladder cancer. So it's a little hard to say. But so far from this study, it doesn't seem like necessarily bladder cancer has as big of a risk of dietary association as some other things. The other ones that we were basing our recommendations on before were breast cancer and colon cancer largely. So there's a study of 1,500 women who were treated with early stage breast cancer. And they looked at people who had over 5 fruits and vegetable servings per day and walked at least 30 minutes 6 times a week. And they found that they had a much, much bigger survival advantage. And then there was another study looking at 1,000 people with colon cancer. And they found that those who were drinking a lot of sugary drinks, like sodas, and those who were inactive or overweight ended up having an increased risk of cancer recurrence and death. And then there was another study in 2009, and this one was a little harder to interpret, but it looked at 70,000 people, and the question was, does organic food make a difference? And they did find a decreased risk of cancer with those with increased organic consumption, and the absolute risk reduction was 0.6%, which means that out of 100%, 0.6 of that they attributed to the organic, but that's still pretty significant, and it was a fair amount of people, mostly women. There haven't been that many big studies since then, and I'm not sure why that is, but I'm curious to see if that still holds. The big thing with organic, or just when you're trying to decide if something's organic or not, and if it's worth the extra money, is what are the risks and what are the benefits? So the thing that I think we worry about the most with non-organic food is the pesticides on it and the amount of pesticides on it. And so the environmental working group comes out with 2 lists every year. One is called the Dirty Dozen and the other is called the Clean 15. And the Dirty Dozen is the ones that are the fruits and vegetables that have the highest amount of pesticides if they're non-organic. So strawberry, spinach, and kale are pretty much always at the top. And if you look at this list in general, it's basically things where you're eating the skin. And so the hard part with kale that's a little disappointing is a lot of the prepackaged salads have non-organic kale, and so it's hard to know if those are actually healthy if you end up buying them. And then as far as the Clean 15 list, these are the ones that have the least things on them. So usually these are things where you're not eating the skin. But avocado, surprisingly, sweet corn is on there. Pineapples and things kind of where they're protected on the outside. So this is just something to keep track of when you're trying to decide if it's worth it or not. So probiotics is a really difficult one for bladder cancer in particular. There have been some promising studies on probiotics, but it's difficult to make a general recommendation because there isn't enough data, and all of the studies that, well, a lot of the studies that have shown benefit were funded by the companies that are making the probiotic too. And so there's this one drink up in the top right called Yakult, which I've actually never tried. It's this pinkish Japanese drink that has a probiotic called Lactobacillus casei shirota. And they found that with this, as well as another Lactobacillus family member called Rhamnosus GG, that there may be a benefit in decreasing risk of recurrence, but there isn't enough data to say it. And there's also been some studies where they looked at infusions of chemotherapy with a little bit of probiotic, one of the probiotic agents too, and showed some decrease of recurrence of superficial bladder cancer. But it's really hard for me to make a recommendation based on this, particularly since the Japanese study was done with the Japanese diet. And that was the one looking at Yakult. A lot of the studies have been on that. And so it's hard to know if that's as accurate for an American audience or not. The next one we're just going to touch on briefly is exercise, because this was a big source of stress for a lot of people. In general, most people feel like they're supposed to do exercise. They're supposed to do more than they are, and then feel guilty for not doing enough exercise, even if, regardless of the reasons. And a lot of times people weren't able to exercise because they were tired from treatments, or they were having a lot of pain and it was difficult to exercise, or they just didn't have time. And so with exercise in general, I'd say there are a lot of studies, and it may be the best thing that we can do for ourselves. The things that we found that are effective is to find activities that people enjoy rather than trying to do, like a lot of people say they want to think that they want to run, but they hate running. So find something that you enjoy doing, make it easy to do, just do it a little bit and start small and then build a little bit. Oh yeah, sorry, Sima. Oh, I don't think that's okay. And then in the beginning, exercise a lot of times is
Let me just remind everyone, if they don't mind, if they can mute themselves. Oh, there we go. Perfect. Sorry. Go ahead, Sanjay.
Oh, no, cool. Sorry, I didn't mean to pause my screen. Okay, thank you. But yeah, in general, and so with exercises, doing a little bit at a time and building on it can be really helpful. And when I mean a little bit, I mean 2 minutes a day starting. And in general, starting with a bunch of successes in the beginning and making it easier to do tends to positively impact the ability to do more later. But most of it is to, and a lot of this talk in general, I think I'll say a few times, is to not stress or beat ourselves up for not exercising as much as we think we're supposed to. Just starting wherever you can start and then building seems to be the best way to do any of these healthy habits. But most of the exercise studies have shown positive effects on mood, energy, overall health, and then survival benefits for other things. I'd like to talk a little bit about herbs and supplements. So there's a Dietary Supplement and Health Education Act of 1994, and this classifies vitamins, minerals, botanicals, and amino acids as supplements that can be marketed without proof of safety or efficacy. So basically this means that an herb or something can kind of come out and say, and be sold without showing that it's safe ahead of time, which is the opposite of medications, which really need to be proven they're safe through multiple clinical trials. they're not allowed to say that they treat or cure anything, but they can say that they support health. So a common one is saw palmetto for BPH. And they can say it supports urinary tract health, but not that it treats benign prostatic hyperplasia. So the thing that makes me nervous about herbs and supplements is they're not regulated that well. It's getting better. There was a raid a few years ago on Target and a few other companies that had a lot of supplements, and they found that they didn't have the ingredients that were in it, and they fined the companies that were selling them. But they're often filled with junk. They can be dangerous if used outside of context, and they're difficult to study in controlled clinical trials a lot of times because they might have multiple active compounds. And that's one of the benefits of herbs and supplements, is that they do have multiple active compounds. Sometimes they help with the side effects of different parts of the formulation, but that makes it harder to study them. And they can work really well to address gaps in our current treatments. Turmeric, I think, is a really interesting one. And in bladder cancer in particular, it's been shown in the lab to inhibit the growth of some bladder cancer cells and the invasive abilities. This has not come to clinical practice yet, but in general with turmeric, a lot of times, or curcumin, which is the active ingredient from it, we often recommend taking it if someone's looking for the anti-inflammatory benefits of it, whether that's for anything from arthritis pain or an autoimmune disease. Usually we recommend giving a shot with curcumin or turmeric. It tends to have a pretty good safety profile, and it tends to be well tolerated. It just can get expensive, and it's whether or not it's beneficial to an individual person. With people getting the BCG infusions where we're trying to cause inflammation, it didn't seem like turmeric causes a negation of that effect, but it is something that we were thinking about, and there isn't enough data on it. But turmeric does seem to be safe for other aches and pains, and we were recommending people to give a trial if they're having pain after their BCG infusions. There are some resources for herbs and supplements that I'd recommend. Sloan Kettering has a nice website. And if you just type in Sloan and herbs, it'll pop up. It doesn't tell you specific brands of herbs and whether or not they're safe, but it goes through the herb itself. And then I'll show you some pictures of the slides of the website in a second. There is a third-party testing site, Consumer Labs, that you can sign up for, and that costs $2 to $3 a month, and it goes through different products. It's probably not worth it for most of you. I have a membership because I use it at work, but otherwise it might be worth it for a short time if you just want to check it out and look up a few things. In general, Kirkland brands tend to be safe and have what they're supposed to have in them, but it is surprising how many things don't. So this is what the Sloan Kettering website looks like. Here's an example of kava. So it shows usually a picture of the herb, what the purported uses are, how it works, and then any interactions it might have with medications, as well as a bit more information on adverse reactions, herb-drug interactions, and a clinical summary that gives you references, including scientific evidence for it so far. And under the purported uses tabs, it gives you quick bullet points of whether or not they think it works or if the evidence shows it. And so I think this is a nice site. It's really easy to use. They updated it a few years ago to make it really streamlined. There used to be a few other herb resources on the internet, but they kind of weren't updated regularly, so they took them down. And then this brings us to yoga and Tai Chi. So one of the things that we ended up recommending for a lot of people was yoga and Tai Chi. And both of these I like to think about as moving meditations. And they're kind of slow, purposeful movements. So for a lot of people don't like yoga or Tai Chi. And so Tai Chi is these slow, purposeful movements that use your core body movements. So a lot of your hip flexors and a lot of your trunk. And there haven't been that many studies looking at survivorship in cancer with Tai Chi, but some of the big benefits for it are reducing hip fractures and falls later. And in general, it does have a lot of the benefits of meditation as far as people feeling calmer and in more control. And then there are some studies looking at yoga. A lot of those recently are in back pain and finding it to be comparable to a physical therapy routine for chronic back pain. But there's some interesting studies about yoga that I'd like to show you that involve yoga mice. And so Alain Langevin is the director of the NIH branch of Complementary and Alternative Medicine. And prior to that, she worked at University of Vermont and then Harvard. And this was from her lab, I think at Harvard, where one of her grad students was noticed that rats will do this downward dog yoga pose when you grab them by the tail at the side of the table. And so using that, they decided they wanted to test what happens when rats stretch or do yoga. And so they did this 3 different ways. So one, they anesthetized them and they just knocked them out, had them on a table, and didn't do anything. The other one, they anesthetized them and then they stretched them a little bit on this table that bends. And then the third one is they pulled their tail and did the stretch. And so what they found was on the slide D at the bottom left of the screen, if you're looking at it, that arrow that has the double arrow on it, they took this something called carrageenan, which comes from seaweed and is used as a preservative in certain foods or an emulsifier. And if you inject that in the skin, it causes inflammation. So they injected it in the skin of all these mice, and then they did the stretching. And they found that the ones that had passive stretching and active stretching had a decreased growth or decreased inflammation from that lesion. And so this led them to do another study where they took breast cancer cells and injected those into mice. And they found that those that received a stretch versus no stretch had significantly decreased growth of the tumor cells and uptake of them. So this leads to a whole series of questions about fascia and what happens when we stretch, or what happens with fascial communication. And so this is why yoga, people tend to like yoga. That's why I tend to recommend it, and it does strengthen a lot of the core joints. There's a lot of different types of yoga that can be very aggressive that I tend not to recommend for people. But this is some interesting data based on what happens with stretching that hopefully we're going to learn a lot more about in the future. We still don't know that much, but it does tie to me for something that I do, which is acupuncture, and this question of what happens with the fascia and acupuncture. So acupuncture is using these thin sterile needles to go a little bit, maybe like a centimeter usually, into the skin, below the skin into the fascia. And the fascia is also what stretches in the body and communicates throughout it. So to me, there seems to be a relation between what we're seeing with a lot of the yoga mice and some of the benefits of acupuncture. And so with acupuncture, you use these thin sterile needles. They're usually between 0.16 and 0.24 0.24 centimeters in diameter. So they're very, very small. And usually they're about the size of a hair, and they go into the fascia, and then we usually turn them a little bit, and they tend to have different effects. So Len Langevin, again, the one who studied the yoga rats, her earlier study was on acupuncture, and she was trying to figure out what is the property of these points. And at the fascia, she found that they're denser, as far as they have more densely packed nerves, they have more tightly packed connective tissue, and they have different receptors. She didn't do this research, but a while ago, they found that if you give somebody Narcan, which blocks the opioid effects, so if someone's taking a pain medication, you give them that, it blocks the side effects and the benefits. It also blocks the pain relieving effects of acupuncture. So there seems to be some central opioid effects. And then there's also these local anti-inflammatory mediators that are released. So this is from Dr. Langevin's study too. So you put the needle, this is where the needle goes into the fascia, which is this like communication membrane underneath all the tissues in your body. And when you put it in and you wind it, all these proteins grab onto the needle, and it sets off this whole neurohormonal cascade of events, and that seems to lead to the benefits that we see. And then these are 2 studies. One is ultrasound, the other is just from a cell that's been fixed. And basically this is what happens when you put the needle in. It causes this swirling effect. And to me, I think a lot of this is sort of like a stretch effect. And so I think there's some relation between the positive effects people feel with acupuncture and then yoga again. In 2002, the WHO released a statement saying, because of the side effects of long-term drug therapy for pain and the risk of dependence, acupuncture analgesia can be regarded as the method of choice for treating many chronically painful conditions. And this is still hard to operationalize because it is hard to figure out how to deliver acupuncture in the best way. Now, as far as people, there's still a lot of evidence that is lacking for acupuncture. So I'm very biased and think it's effective and non-pharmacologic and safe. And part of the reason I think it's worth further study is because of the data behind its safety. So they took a study of German physicians. In Germany, doctors can practice there with 140 hours of training. Only 20% of people in this study had over 350 hours of training. And they looked at 95,000 patients and over 700,000 treatments. And there were 6 major complications. So one person had an exacerbation of depression. that they felt related to the acupuncture. Another had acute hypertensive crisis. That's where the blood pressure goes really high. Another had a vasovagal reaction and lost consciousness. Another person had an asthma attack that led to high blood pressure and then some chest pain. And then 2 people had pneumothoraces, and that's where the lung can pull away from the rib cage, basically. And that is related to a needle going into that space. And so those are scary complications, but very uncommon. And the pneumothoraces one is easy to prevent, just with just knowing what you're doing. They had about 3% of people everybody had a little bit of needling pain and hematomas. Hematoma is just a small collection of blood, like when you bruise it under the skin. And then they had some people with forgotten needles, which is an acupuncture never event that we'd never want to have happen. Overall, they found that there was non-adverse serious effects for about 7%. And so that's kind of not that different than if you look at the complaints for people who get blood draws. It's actually probably a little bit better than a routine blood draw. So overall, with minimally trained physicians doing this, it was safe. In 2012, the Archives of Internal Medicine reviewed a lot of data for chronic pain, and they looked at different randomly controlled trials and pooled their data into an individual meta-analysis, which means they're just looking at the data from everything. And they found that patients who are receiving acupuncture had significantly less pain than the fake acupuncture for back and neck pain, osteoarthritis, and chronic headaches. And so their statement was that acupuncture is effective for the treatment of chronic pain. So one of the things that we like acupuncture for, and why Dr. Porden wanted to look at it more for people with bladder cancer specifically, was it also works for nausea and pain of other types. There's just not a lot of data on the pain stuff. There is a lot for nausea, and so this is something that all of you can do if you're interested. This is a point called pericardium 6, and basically it's kind of where your wrist creases. You take your 3 fingers and you put it at your wrist crease. And then in between the 2 tendons most of you have, if you push on it, you're going to notice it's like a little sore. That point is called pericardium 6. And we won't get into the naming of acupuncture points too much, but there's different meridians that run through the body in the school of thought, and each of the points has a number along it. That's the standard nomenclature that we use now. But if you put your 3 fingers here and then kind of go in between and push on it, you'll notice it's sore. Usually we recommend clockwise pressure for about 30 seconds, and you can kind of alternate arms. And this is a fantastic treatment for nausea. So they found that in the Cochrane review of almost 60 different studies from 2015, that stimulating this point was comparable to antiemetics for postoperative nausea and vomiting. And so we tend to use this. They use it a lot in our pediatric hospital. Overall, it's a nice thing to add in. Antiemetics in general tend to be well tolerated by a lot of people, and so if there's an antiemetic that works, we like to add this too. And it's fast, which is nice. So on whale watching tours or on boats, you can do this too if you're getting motion sick at all, and I have found that to be helpful. And then there was a question about dry needling. So dry needling is dry needling, it turns out, is a very acupuncture political hot button. And there's a lot of debate about that. So dry needling is the term that's used when physical therapists take an acupuncture needle and use it to release a muscle, like a knotted muscle. I think dry needling is great. And it's very similar, but a little different in the way it's practiced. So I think dry needling can be fantastic for a lot of muscle aches and different muscular things. In general, an acupuncture treatment is both trying to do that, but usually as well as promoting other health, which tends to be outside of the scope of dry needling. Based on the fascia studies with the yoga rats so far and yoga mice, I think they did one on both rats and mice, by the way. That's why I'm jumping between it. But based on that, I think dry needling probably does have some outside benefits too. But I think it's more finding somebody you're comfortable with. There are a lot of skilled acupuncture specialists in the United States. Depending on your state and location, that determines on reimbursement. In California, the Medicaid equivalent, Medi-Cal, covers acupuncture 2 times a month for chronic pain. And then Medicare recently approved it for low back pain based on some studies that were done. But I don't know if that's been operationalized yet. And so that's one of the things that's one of the challenges with it. It depends on your insurance. A lot of the private insurances will cover 20 to 25 visits a year. So if you check with your insurance provider, they probably have a restricted list on who you can see. And then some places, if you're seeing a medical doctor or a doctor of osteopathic medicine who does acupuncture, it could be covered under their general visit. But yeah, so I think acupuncture is worth a shot for anybody, particularly if you have pain, but there aren't any studies on bladder cancer pain with acupuncture yet. There was one that was very good looking at chronic pelvic pain in men who had a non-infectious and a non-inflammatory cause of pain. And they found that this acupuncture treatment reduced their pain significantly with a 6-week course of treatments. And so I'd say we think it's worth doing. We haven't been able to study it yet at UCSF, and so hopefully at some point we'll have some more data on that. One of the things I'd like to come to next, that's also something that tends to be a source of guilt for a lot of people, is meditation. And then I put this slide up because this is what most of us think of when we think of meditation, which is nothing. And I know for a long time for myself, when I would try to meditate, I did try to do it without guidance. And that was I just tried to blank out my mind. I thought that's what I was supposed to do, is to have no thoughts. And that every time a thought came in, I thought I was doing something wrong and that I was really bad at meditation, which may also be true. And I will send out the citation for no pelvic pain, by the way. Okay. But yeah, so meditation, it turns out, is actually pretty fantastic. Timing wise, I think we're okay timing wise to do this experiential. There are many different forms of meditation. Some are very difficult to do and may feel less accessible. Some are very easy. So even a simple breathing exercise like this is a form of meditation. And this one is called 4-7-8 breathing. It probably takes about 30 seconds. And it's called 4-7-8 breathing because you breathe in through your nose for a count of 4. You hold it for a count of 7, and then you breathe out for a count of 8. It's not 4 seconds or 7 seconds or 8 seconds. It's more of the general ratio, and it doesn't need to be that exact. It is a little bit more difficult than most of us realize to hold for 7 and then breathe out for 8 because we're not used to breathing that way. But basically for this one, I'd like you to have your feet flat on the floor if you can. And then we're just going to do this through a cycle of 4 together. So I'm going to just count with my fingers. Yeah, so just take it, we'll probably start in about 10 seconds or so. Okay, so if I could have you all take a deep breath in through your nose with me, and I'm going to count off with my fingers, and then we'll hold it for 7 seconds, and then we'll breathe out for 8, and then we'll do it 3 more times. Okay, ready? Let's take a deep breath in for 4. Hold it. Breathe out. In. Hold it. Out. Breathe in. Hold it. Breathe out. Breathe in. Hold it. Breathe out. And then that's it. So when I do that, it's very calming and relaxing. And it's nice because it's simple, and that is a form of meditation. If you just do this twice a day, you may notice some benefits. It's just a nice centering, quick thing. It's really nice to do because you can do it. A lot of times I'll do it before I'm going to give a talk to calm down, or if I'm feeling stressed or someone's yelling at me for some reason. And it's a nice thing because no one knows what you're doing. You can do it anywhere, and it's always accessible. But that is also a form of meditation, just paying attention to the breath. And mindfulness is a term that we'll hear a lot in mindfulness meditation. And that's the idea of focusing one's full attention specifically. Mindfulness comes from a word that can also be translated as heartfulness. And it's just the idea of being present. It often starts with the breath because we all have to breathe, and returning to the breath because it's a nice central point of focus. And the idea is training of the mind. So rather than not having thoughts or the mind blanking out, the idea of meditation training is that your mind will always wander, and that it's the bringing it back that's the attention. So the mind will, so you'll sit there, you're focusing on the breath, and suddenly you'll be thinking of pink elephants, and then maybe you'll think about those elephants for a while, and then you'll bring it back, and then you'll be focused, and then you'll think that something else will pop in, and then butterfly, and then it comes back. And the bringing it back is the training. And one of the things that helped me with meditation, because I really hated it for a long time and wouldn't do it very much, and I've only really recently started doing it regularly, was instead of getting mad at myself every time my mind would wander, to be grateful for the wisdom to recognize it's wandering and bring it back. And that has been transformative of making it a practice that I hated because I would always feel like I was failing with it, to something where now I like it. I'm not at loving it yet because it's still difficult and there's so much wandering and so much bringing it back, but it feels good and it feels healthy, and I'm glad I'm doing it. And it definitely does bring peace and calm and a little bit of space between reacting to things. And there's been a lot of studies on meditation's effects, and they found that it modulates the autonomic nervous system, which is different from relaxation alone. So you get a relaxation effect, but it also has added benefits because your mind is also clear and sharp. There have been studies looking at enhancing the immune system, including increasing antibody productions with vaccines. This is pre-COVID. There aren't any on the COVID vaccine with that. They look at experienced monks who have meditated a lot, and they found that there's increased thickness and left prefrontal cortex activity. And so that's the idea that there's more of a space between responding and impulse control than there is in other people. At least those are the brain areas related to that. And there's been some studies on endocrine and hormonal changes with reduced cortisol and increased melatonin levels. And mindfulness-based stress reduction, MBSR, is a fantastic thing if any of you are interested in it. It's a structured 8-week program. It's 28 hours in total. It was created in 1979 by John Kabat-Zinn, and was really, part of the brilliance of the way he did the program is he made it secular. It's based on Buddhist meditation practices, but it's secular and available to anybody. But he put it in healthcare settings and studied it from the beginning. And so there's quite a lot of data on it. But the idea behind it is it's deliberate, sustained, non-judgmental attention. And it's been shown to enhance self-awareness, change maladaptive thinking, increase the capacity for skillful responses. So instead of just reacting, there's a space, and then, how do I want to act, as opposed to just acting. And this idea that it reduces suffering overall. There's been over 200 studies for MBSR, and it just keeps going up, looking at anxiety, depression, stress, pain, and what they describe together as cancer-related symptoms, which is anxiety and depression related to the diagnosis, stress and quality of life, and any sort of mood disturbance related to it. And so who's right for mindfulness-based stress reduction? So it takes a lot of motivation and takes time. And it's a 28-hour thing, about 3 hours a week for 8 weeks with a half-day retreat over a weekend day in the middle there. There's a lot of direct exploration of unpleasant activities, and that can be difficult. So a lot of it is sitting with whatever it is that we're trying to avoid, and becoming comfortable with it being there. And the contraindications for it are untreated psychosis, mania, and somebody who's using a lot of active substance use or intoxication. It can be difficult for those groups of people. So mindfulness-based stress reduction is a big time investment. And kind of like our breathing exercise, guided imagery is not necessarily as much of a time investment, not invention. So guided imagery is the name can be confusing. Basically, guided imagery is your eyes are closed, you're usually listening to something or someone, and they're guiding you through a visualization. And that's what the imagery part is, that is designed to make or help somebody feel a certain way. It's a form of self-hypnosis, and so it's like hypnosis when you're hearing it. It doesn't require the time investment at all that mindfulness-based stress reduction does. It is wonderful alone because it's just accessible that way, but it's usually better with a practitioner because they can do a more individualized session. Marty Rossman, or Dr. Rossman, lives in Larkspur, which is just north of San Francisco, and he's been a great resource for us. And Dr. Fortin has done a study with him using guided imagery for preoperative care. And his website is thehealingmind.org, and there's a bunch of free resources on there that I'd recommend. And there's also free guided imagery that you can get anywhere with internet on the UCSF OSHA website too. So if you type in UCSF guided imagery, it should come up, and there's maybe like 12 different links on there. And on Marty's website, there's a bunch of different links too. And so there'll be a lot of things for stress, sleep, pain, anxiety, well-being, and depression, and cancer-related symptoms. And so I'd recommend checking it out if you're interested, and it's free. Kaiser also hosts, or at least they used to also host, guided imagery, and you could download it if that's easier for you on your phone, if they're still doing it. And the links that we have on the OSHA website and the ones that Kaiser use is a wonderful practitioner, Belle Ruth Naperstek, who does a lot of guided imagery, and her company is called Health Journeys. You may have seen that around. They've done some studies on guided imagery for surgery, and one was a big systematic review. So they just looked at a bunch of different people getting surgery and the different mind-body therapies that were used. And 8 studies looked at guided imagery, and there was strong evidence for improvements in psychological well-being measures and moderate support for the ability to reduce the amount of opiates people were taking, or analgesics in general. It wasn't just opiates, so that could be Tylenol too. With guided imagery, there is a recording specifically that Belle Ruth has, and there's one that Marty has, where it's designed to make you comfortable for being in the operating room. So people will typically listen to it starting a few weeks ahead of time, and it gets the person to feel relaxed, and then it says you're in the operating room. And so it's just designed to make somebody comfortable. So I think, Carlos, you mentioned that your wife was going to have a big surgery coming up, so this might be something that she's interested in. And then they looked at guided imagery, and they looked at wound healing. And this is a really fascinating study that came out about 10 years ago. And they took people who are doing a laparoscopic cholecystectomy. So that's where they minimally invasively with the cameras will take out the gallbladder. And then they randomized them to get a psychologist talk with take-home guided imagery or not. And they looked at these things called PTF tubes, which are just some tubes that are related to the cholecystectomy, these drains that they put in. And they took them out, and they looked at these proteins on them that were markers of wound healing. And then they asked people about their stress. And what was really fascinating is the perceived stress scores changed. So people who had guided imagery, that they had felt less stress, but they found that there was a higher amount of these proteins that are consistent with wound healing on the tubes for the people that got the guided imagery. And so that's really fascinating. There hasn't been much follow-up on that, but it's such a simple intervention, and people feel good with it. I feel like it's worth doing. And as far as simple things that do seem to have benefits, aromatherapy has a terrible name to get anybody to take it seriously, but it does seem to have some pretty beneficial things. And it utilizes essential oils and their smell, typically. And essential oils are these volatile liquids that are extracted from plant parts. And it takes a lot of a plant to make a little bit of oil. They use it a lot in our pediatric hospital for nausea, pain, relaxation, sleep. And they're surprisingly potent for some people and have immediate effects. Some people really hate aromatherapy, and some people will get headaches around it. So it's just something to be cautious with. In the hospital, one of the things, if we're going to use it, we just make sure that whoever the care team is involved with somebody, that none of them have migraines that would be triggered by a scent. And then if there's a roommate, that's same is true. But it can be effective. And they did a study of this in the Allina Health System in Minnesota. And they looked at about 10,000 patients who were over 18 at 10 of their hospitals that were admitted to the hospital, and so it didn't include the emergency department or obstetrics or outpatient clinics. They looked at pain, nausea, and vomiting for a nursing-delivered essential oil intervention, where they basically would either put a little bit on their skin, on a cotton swab, or both. They used lavender, ginger, sweet marjoram, and mandarin. The latter two are citrus scents. And they didn't have any side effects. They looked at about 10,000 patients. And so this table, hopefully you can all see pretty well. Table 3 is just the different essential oils and how they use them. And that's not that important. But table 4, so this is on a 10-point scale. And the effects on pain, anxiety, and nausea are pretty remarkable for such a quick and easy intervention. So the main one that I tend to bring in the hospital is lavender, because it can be a nice relaxing thing for people, and it can also help with pain, and it can be pretty quick and surprising how effective it is. My main concerns with essential oils in general is I don't know how environmentally friendly they are or sustainable. And then a lot of people push them to cure a lot of things or to have a lot of effects that they don't. And there's a lot of money in it right now. So I'm just skeptical about ads based on it. But that said, they can have really potent effects. And I think if you're having pain, it is probably worth the trial of half, actually, I don't know how big they are or how much fluid is in them, but they're usually about 5 milliliters of lavender, and it tends to be around $8 of one of the essential oils. And that's probably worth a try to see if you notice benefit with it. Another thing that I think is worth a trial for pain or even sleep and anxiety is cannabis and hemp related products. And so in California, cannabis is now just generally legalized. And it's something that a lot of people have questions about. So we ended up talking about it a lot in the Joy Clinic that I did with Dr. Fortin. And so cannabis, the plant is Cannabis sativa, Cannabis indica, and Cannabis ruderalis. It's been used by humans for a long time. They found graves from one of the earliest graves had some cannabis in it. There's over 1,000 known strains. Until the last year, I think, and I think it was, I can't remember if it was this winter or last winter, everything is kind of strange timing-wise with COVID, but it became legal to study as a clinical intervention. Prior to that, it was only legal to study it as a drug of abuse. And there might still be some restrictions. I don't do research in this field, so I don't know what those are right now. But the reason there isn't a lot of clinical data is it wasn't legal to do until recently. It's legal in 33 states and DC, and it's recreational in 12. It contains a lot of different chemicals. So it's not just THC or not just CBD, which we're going to discuss briefly, but it has terpenes, flavonoids, alkaloids, and cannabinoids. And it is very different than it used to be. And so a lot of patients who have tried it have said to make sure to tell other people it's a lot stronger than it used to be. And their experience is true. So, or has been shown to be true based on sampling. So the concentration of THC in plants from 1996 was about 4%. And in 2012, it was 12%. And I imagine it's even higher now. So how does cannabis work? So there are cannabinoid receptors that exist in our body. And the main ones that we study, and there's a lot more, but CB1 and CB2 are the main ones that we talk about. And so the CB1 are the light blue, and then the CB2 are the more purplish blue. So the CB1 cells are in the brain, but not in the brainstem. They're in, and they're throughout the body. The CB2 cells are in the tissues and cells of the immune system. And so for CB1, when that's activated, that can cause euphoric effects, lowering of blood pressure, anti-inflammatory effects, these immunosuppressive effects, anti-spasm effects, pain relieving effects, and can stimulate the appetite. Whereas the CB2 ones has been looked at for anti-inflammatory and immunomodulatory activity. So this is just a run through again of the CB1 receptor. One of the other things is intraocular pressure. And that was one of the earlier things for cannabis that was looked into was glaucoma treatments. It does affect cognition and neuroexcitability and the reward impulse. CB2 is more related to immune function, the way cells divide, inflammation, and pain. And they did this really interesting study on rheumatoid arthritis, which is a clear inflammatory arthritis. And they found that the cells released by some of the fibroblasts, it reduced the inflammatory markers by it. And so that's really interesting. And there may be something similar that we see in other inflammatory things. So THC and CBD will come up a lot. So THC is delta-9 tetrahydrocannabinol, and that's the main psychoactive component. So when people talk about getting high from cannabis, it's the THC that they're usually talking about. And that also has pain relieving effects, anti-inflammatory effects, and is tightly bound by both CB1 and CB2. It's mostly highly concentrated in the resin of the female plant. And then it's a 21 carbon terpenophenolic acid. And there might be hundreds of others that also have effects, and a lot of different strains are being studied now. And then cannabidiol, CBD, is not psychoactive. It has a low affinity for the CB1 receptor. It is a little bit antagonistic towards it. And then CB2 receptors. It is somehow, it related to capsaicin, which is one of the ingredients in hot peppers that we use if somebody's having neuropathy. If you put capsaicin on, it can help. if you get it in your eyes, it's like getting red peppers in your eyes. So that's one of the challenges with the treatment. And then this TRPV1 receptor, which is related to pain. And then 5-HT1A agonist, and that's one of the serotonin receptors. So it has a bunch of different properties that are a little strange. It's an antioxidant, anti-inflammatory, immunomodulatory, and anti-seizure medication. CBD and cannabis legalization largely has come about recently because of its effect in pediatric seizures. There's this one type of pediatric seizures that I've never seen clinically that responds really well to CBD, does not respond to other medications very well. We have no idea how it works for that, the anticonvulsant, or a lot of these other things. And it is a potent cytochrome P453A11 inhibitor, and that can affect a lot of medications. So I would just recommend discussing with your treatment team, whatever, if you are using anything. So THC does have a fair amount of adverse effects. So it can be agitating. It can cause psychiatric side effects. There's this chemical called anandamide that is increased in schizophrenics that can be activated by THC. It does not depress respiration, and that's one of the nice things about cannabis in general is we don't see overdoses related to it because there's no CB receptors in the brainstem, and so massive amounts of cannabis doesn't cause respiratory depression. We have had deaths though over the past few years with this increased concentration of THC still. Chronic use of cannabis does seem to lead to depression and anxiety. It is probably not healthy for a developing brain. There may be a risk of THC in testicular cancer. It can cause gynecomastia, which is breast development in men. There is a mild increased risk of myocardial infarction, so of having a heart attack with this. But there's not enough data that I don't want to freak people out about that. I think it's related to the increased heart rate, but it's something to be concerned about. And then there is a myth that cannabis is not addictive. About 10% of people who use cannabis will end up having a cannabis use disorder, particularly with this increased concentrated cannabis. It can be even more dangerous for that. So it is addictive, and it's something that's really important to be careful about. CBD in general is pretty well tolerated. So usually there's no side effects. But if there are someone might be sleepy with it. Some people will get diarrhea, and a lot of that might be with the oil formula, the way it's formulated. A lot of people will feel tired. Some people have reduced appetite with it, but I haven't had that anybody explain that to me or experience that. And then there's a theoretical concern that I have about medication interactions, but I haven't really heard anything about it. And the benefits of CBD and why this has been looked at a lot is, one, it's not psychoactivating, so people can take it and function normally. There's an anti-inflammatory, and analgesic, anti-nausea, emetic, anxiolytic, and anti-seizure benefits of it. It's widely available as a wellness product. If you go to San Francisco Airport now, you can get CBD is being sold there now. It must have less than 0.3% THC if it's derived from cannabis sativa to be called a CBD product. And hemp refers to cannabis strains with less than 1% THC. And hemp oil is different than CBD oil. So if you're looking to buy CBD, hemp oil will be sold as a certain concentration, but that doesn't equal CBD concentration. Hemp is not a controlled substance, and that's due to the Farm Bill of 2018. And so people who are concerned about drug testing or that can't use cannabis for work will often use a hemp product that just is pure CBD alone. Whether or not other CBD products will cause a positive drug screen test for cannabis, I don't know. And it's just a concern that a lot of people have. So there was one study done on cannabis and opiates here at San Francisco General Hospital, and they took 21 people who were on long-acting opiates, and then they were admitted and they were given vaporized cannabis for 5 days. They sampled their blood every 12 hours on day 1 and 5, and they looked at the metabolism of cannabis and the pain medications. They found overall that pain was decreased by about 30% in these people, and that there wasn't any significant change in the way that the medications were metabolized. So their conclusion was that this is a nice adjunct to add in to people who are on chronic opiate uses, that it's safe and it may decrease the need for more pain meds. So it does seem to be safe as well. So with cannabis in general, it is promising for cancer-related symptoms because of the pain, particularly CBD. And so if anybody was having uncontrolled bladder pain, we thought that it was worth a trial with CBD. The downside is we didn't want anybody smoking anything because of the tobacco smoking associations with increased cancer risk, which is very clear. But there's a lot of oral preparations and they're kind of like oil droppers. And so we thought it was worth a trial of CBD. The big downside is cost. Usually to test out if CBD is worth it for somebody, it's at least $50. And we tend to say start slow and then gradually increase. So we'd usually have people starting, depending on how medication sensitive they are, at a few milligrams and then going up by a few milligrams every evening and just taking it before bed to see if they notice a benefit or a side effect. Treatment doses tend to be higher for a lot of people with CBD. It's often around 10 to 20 milligrams, for some people even higher. But the main thing with CBD is just seeing if you notice any adverse events or anything affecting you negatively. So far from what we're seeing, it does seem to be pretty safe. With THC or with full spectrum cannabis or other cannabis stuff that's not just CBD, the main thing is some people really enjoy the way they feel with it. And if it's not causing adverse events and it's helping with pain, say go for it. And then some people really hate the way that they feel. And so that can be, it might be worth a trial, but you may love it or hate it. And so it's just something to be careful of. And especially the risk of cannabis use disorder is something to pay attention to. And it is expensive, and it's gotten more expensive with legalization. And then we wanted to talk about psychedelics just because it's such a hot topic right now, and it's come up in so many things. So just a quick review of the history of psychedelics. So right before 1900, Arthur Heffner isolates mescaline. And for thousands and thousands of years earlier than that, a lot of people have been using psychedelic drugs, typically as part of indigenous rituals and ceremonies, and typically in groups. And then in 1938, LSD was synthesized. And then 5 years later, Albert Hofmann, whose name you'll hear a lot of with psychedelic research, discovers that it's psychoactive. Started testing it in mice a few years later. Gordon Washington went and visited an area in Mexico and published a Life article on magic mushrooms or the psychedelic effects of psilocybin. Albert Hofmann isolated psilocybin, and then about 10 years later, in 1970, there was the Controlled Substances Act that prohibited research in this. Between the mid-1950s and 1970, a lot of research was done in psychedelics, typically looking at mood and substance use, and tended to have pretty positive effects. In 1988, looking at psychedelics, they found that the 5-HT2 receptor was a target for LSD. And they found that because they found an agent that blocks it. And then in 2006, though, for me, is when this really became a thing. That was, I can't remember if this was while I finished residency in 2006, and I can't remember if I was still a resident or if I just started being an attending then. But Johns Hopkins came out with a study on psilocybin, and they took a bunch of healthy volunteers. They took about, I think they took 60 people in total, and then they split them up. And they gave some a sort of placebo that had some effects, and then a psilocybin dose. And the results were pretty remarkable. And then they followed it up a little bit over a year later. The majority of people said it was one of the top 5 personal experiences of their life, spiritual experiences of their life. And then the majority of people had increased well-being over 2 months out, but also over a year out, and positive behavior change, not only 2 months out, but also a year out. And so this kind of opened up a lot more research in the field. And this was just on healthy volunteers who had not had psychedelic use before, but were spiritual practitioners. So this is just briefly on what happens with psychedelics. So 5-HT2 is one of the serotonin receptors, and there's a lot in your brain and your gut. And it seems to be the main part of the psychedelic effect. So they figured out that this was related because they made a molecule called catenserin, and that blocks 5-HT2. And when they did that with psilocybin and LSD, they found that it blocked the psychedelic effects. So serotonin alone with 5-HT2 is a pro-inflammatory thing, which is weird because all the studies on psychedelics, it has been very, very strongly anti-inflammatory. You may have heard a lot of talk recently of people doing microdosing. No one really knows what to make of microdosing, but what they have found is that psychedelics, both LSD and psilocybin specifically, at very, very low doses, very pre-psychedelic or psychiatric effect at all, has potent anti-inflammatory effects, and it's the only anti-inflammatory like that we found. They did this in a study on mice where they gave mice who had risk for asthma, they gave very low doses of LSD in it, and it kind of acted like an anti-asthma drug. So we're still learning more about that. But psilocybin has been studied in cancer a fair amount. And this is where a lot of the press has come. So in 2016, Ross, who's one of the main names at NYU who does this research, took 30 patients and did a double-blind crossover study. So half the people would get psilocybin in the beginning, and then half the people wouldn't. And then halfway through, they would get psilocybin or not, depending on what they got earlier. Everybody had psychotherapy, and then they were randomly assigned to the single dose of psilocybin at 0.3 milligrams per kilogram, or not. And then they crossed over at 7 weeks. What they found with the psilocybin was that people had, and this is the one in mushrooms, that people had immediate and sustained improvements in anxiety and depression. They found decreases in cancer-related demoralization and hopelessness, and they found improved spiritual well-being and quality of life. And these were all in 6.5 months follow-up. They found that the psilocybin treatment was associated with enduring anxiolytics, so decreased anxiety, and antidepressant effects, with 60 to 80% of the people having reduced symptoms. They found sustained benefits in this idea of existential distress. Since a lot of these people had end-stage cancer and were expecting death within a few years, they found that there was an increased comfort with the approach of death and with quality of life in relation to that, as well as improved attitudes towards death. And then the psilocybin, what they found was that there's this mystical experience thing that comes in through with it. And that seems to mediate how therapeutic of an effect somebody got. So the more of a mystical experience somebody had, the more of an effect on anxiety and depression. That's also true with substance use. Particularly, there's been a few studies looking at quitting cigarettes, using psychedelics and alcohol. And they found the same thing, that the more the mystical experience, the better the effects on substance cessation. And then just a few months ago, I think this was in May, this came out in the New England Journal. And it was a study where they looked at the antidepressant escitalopram, which is one of the newer antidepressant medications, tends to be pretty clean, relatively speaking, versus psilocybin. So they basically had people take 2 25 milligram psilocybin doses 3 weeks apart, and a placebo, versus escitalopram and a placebo. And they found they're pretty comparable. If anything, the psilocybin group was better for depressive symptoms, and that was just on 2 doses 3 weeks apart. So this was the first big study just looking at depression, and there are many other trials coming out. So the effects of psychedelics on mood is something that's really fascinating as well. And overall, psychedelics seem to bring this sense of awe and a feeling of connection, as well as a shift in perspective and gratitude. And one of the things that I didn't get into was, as far as the physiology of psychedelics, different parts of the brain communicate while people are using them on functional MRIs that don't normally communicate. And so there's an idea of kind of shifting things or reframing the way that we see things. We're still learning a lot about them, and I think we're going to see psychedelics used more and more. I'm particularly curious, though, about this relatively new thing of the anti-inflammatory effects of them and what we see with that. So my general summary for everything we talked about is that we have a lot more to study, and now we'll talk about stuff. And so I will stop sharing my screen. Thank you, everyone, and we will talk. Okay. And I saw a chat thing, but I haven't read it yet. Let me see really quick.
Hi, Dr. Reddy. This is Carlos Glender.
Yeah.
Great presentation, by the way. Really appreciate all the information you put out. But with regard to psilocybin mushrooms, I don't believe in North Carolina they would be legal, or a lot of parts of the country they would not be a legal option. And what are your thoughts on that?
I think in general, most parts of the country, I think it's decriminalized in certain areas, but I think it's still legal everywhere. In Oakland, for example, it's decriminalized, and then in Oregon, it's decriminalized. But I think in San Francisco and the rest of California, it's still fully illegal. There are trials that people can get into with using psychedelic-assisted psychotherapy, and that's one thing I didn't mention with all the psychedelic things in all the trials. is set in setting and context is very important. And so working with, usually the way most of the studies have been done is a person will be given a dose of the psychedelic and then in a comfortable room, usually with like a musical playlist of some kind playing, and there'll be two therapists, someone who identifies as a man, someone who identifies as a woman, who are there watching them, and then they can interact or not interact depending on how they're feeling. And it's just a very comfortable environment. And they found that so working with a trained professional, I would say, is incredibly important. So it might be a little too early right now, Carlos, for like to be accessible for everybody yet.
Yeah. So for now, your options like guided imagery and meditation would probably be more of a common way to reduce anxiety and stress. Is that correct?
Exactly. I would say that, and then exercise seems to be a really good one too. And if somebody is up for it, but I think any of those would be great options. It'd be worth for anxiety.
And just to talk about exercise, one exercise that I found very helpful. It combines exercise and breathing, but competitive master swimming. As a swimmer, I can compete in my age group. And I find that very relaxing to practice with my team and then set goals and actually compete at different swim meets across the country. That's it's a very aerobic exercise, yet it's very low impact.
Yeah, swimming's the best. That's great that you're doing that. And it has such a big benefit too, because you're building muscle and you're doing the aerobic benefits too.
Yes. But thank you.
Oh, you're welcome.
Sanjay, I just wanted to say that that was such an interesting presentation. I took so many screenshots, and you know, the effect sizes on some of those studies were, and I'm sorry, it's noisy back here. The effect sizes on some of those studies were just quite shocking, actually, like with the essential oils and things like that. How have you guys, because I know you and Seema have done some work up there, how have you guys been implementing some of these, or sort of protocolizing some of these things for our cystectomy patients, for example?
You want me to take that one?
Yeah, please.
Yeah. So we finished our trial on looking at guided imagery, which happened to be a recording from Marty Rossman, and showed that just with 2 weeks, and patients doing it from anywhere to every day to like just a couple times in those 2 weeks, that you were able to reduce anxiety from major to almost none. And that's measuring it the day before surgery. And it's listening to a recording, and that was a randomized trial. And so we're working on publishing that, but I would say that those findings already have us be able to recommend those free recordings, right? And so that's from our Osher Center website for our patients. I think the intent of the guided imagery and reducing anxiety, the patient comments that came from the trial itself were also great. Many people thought it helped them sleep, and that was the biggest benefit, because I think sleep is really understudied in bladder cancer for both non-muscle invasive and muscle invasive patients. I don't think people realize how much sleep deprivation can make you crazy. I think some of us do, but and how much how important it is for us to be able to cope with daily life, right? And so from that aspect, that's a small thing that we're able to kind of operationalize quickly, and with not too much cost, since there's a lot of free resources. Other people have said that instead of guided imagery, what they kind of ended up working in was religion. And so for some people, it was that connection with their church that helped with that calming meditative effect. The breathing strategy is something I use with a lot of patients, particularly prior to cystoscopy, so a little different from muscle invasive to non-muscle invasive patients. I don't think Sanjay had time to talk about how we're hopefully going to increase access to acupuncture, particularly ear acupuncture, which works quite well with pelvic pain. And so teaching physicians how to become competent in that is something that's one of our larger goals. we applied to have maybe like an AUA course to teach urologists how to do that quickly. So people have access to that for painful procedures. And so those are some of the things that we're working toward in doing that. I think there's a question from Jerome, so I'll be quiet and let people ask Sanjay.
Well, Sanjay, I'm sorry I was a little late coming to your talk, but I really enjoyed it. I wanted to ask you what your role is at UCSF, because I've been treated there by Dr. Maxwell Meng and also Terry Friedlander, and they are just two wonderful people. And I was just wondering what your role was and whether I could get in on some of the psychedelic testing.
Yeah, no, that's a great question. So pre-COVID, I was the associate director at our Integrated Medicine Center, the Osher Center, and I would split my time doing clinic there and then doing inpatient internal medicine primarily at our Parnassus Hospital, and doing clinic with Dr. Porton at the Mission Bay Hospital. So in March of last year, I switched back to doing full inpatient work. So I don't do outpatient care anymore, and I'm just doing inpatient internal medicine. My role with psychedelics has mostly been safety review. So we did a small psychedelic study at UCSF, but it was looking at people who have HIV and who had an AIDS-defining illness and survived, and it was looking at there's something called AIDS demoralization, and it was looking at the change in that with people who underwent it. So it was a pretty small study. It was about 30 men underwent the study, and we found big benefits in their improvement of AIDS-related demoralization. But the follow-up studies, there's going to be a lot more studies happening at UCSF now, and I am not involved with those, but it's become a fairly hot topic in the psychiatry and neurology departments.
Thank you very much.
And Seema, thanks for bringing up that prayer is also another form of meditation, and that it's kind of that all those things that cause a pause or a space seem to be beneficial.
By the way, Marty Rossman is one of my best friends, and he's treated me quite a lot over the years. In fact, he was with me at my diagnosis 24 years ago.
Oh wow, yeah, he's an incredible doctor and human being. It's a pioneer in so many different fields.
And I see Michelle has a question.
Thank you, Seema, and thanks so much, Sanjay. Just really excited about the information, but of course, for me, it's about how do we get this in the hands of the patient, but more importantly, and this is as an old clinician myself and a practitioner, as a nurse practitioner in the day, how do we make this information front and center at that point of care? Because when a physician, your treating physician can segue this information, there's a bond of trust, there's a credibility, there's like, it's an integration into your care plan. You know, so I'm thinking, and this is a question in terms of BCAN too, because here at Bladder Cancer Canada, I'm thinking, how do we create an information platform for this with credible resources? So that's going back with me as a board member, that I'm also just so interested as, you know, getting this into the hands of clinicians and asking and pleading with them to use it and making it available in that such, you know, important point of care piece where you're diagnosed with bladder cancer and then you stop listening, right? I mean, like, I just remember to this day what that felt like. But then I also knew that I had enough, you know, tools in my toolbox in my own practice of bringing a lot of the alternative therapies together to do it for myself. But there's, you know, you triggered on stuff like prehab and, you know, integrating this with other therapies so you can have conventional and alternative. So it's complementary approach to and an integrated approach to this with such documentation and research and science on the proven outcomes of this. It's just a sad day when I don't see the common urologist bring this to the fore when I'm going in for major surgery, that I can't have someone sort of tell me about, let's take a breath, you know, like that just, opens up so many things that I think are such a possibility. And, you know, here in Canada, obviously we practice under a different medical system and everyone's there, you know, a private practitioner, but man, oh man, wouldn't it be amazing if all physicians were trained equally so to bring this to their patients. So maybe a comment more than a question, but I just would love to know where the magic could be at that point of care and how, again, maybe Beacon is using this in a way that we should take note.
So, so Seema and I and Alondra Hurtado, who's a medical student at USC, are working on kind of summarizing a lot of the recommendations that we made during our time with the clinic into a best practices for integrated medicine for bladder cancer. So hopefully that'll be coming out this year in 2021. But the big challenge that we had both with clinic and even with this talk is there's a lot of general things that look good with our recommendations, but there's not a lot of specificity or not specificity, but specifics in bladder cancer, or a lot of data looking at bladder cancer or some of the outcomes. And so some people will look at the data and say that there isn't a lot of data at all for it. And so I think, and that's also a fair argument, I think, to make. I think one of our approaches was looking at the risk, the harm, and the cost. And so most of what we're recommending is very low risk, is really safe for people, is inexpensive, and is accessible, and is inexpensive to free, accessible, and people, even if it doesn't seem to impact their cancer directly, it seems to benefit a lot of other aspects of life. But with most of what we're looking at, diet and exercise and those things, it can be tough to have, there isn't that much data specifically in bladder cancer. So that's one of the challenges that we address in the paper too.
And Michelle, also, this might be an ask back for you, is that we have some of our patients here involved in helping to draft that best practices statement, because both Dr. Reddy and I feel very strongly that it needs to be, it's going to take us a while to change our culture in surgery and urology, right? In general, like we're just having women as surgeons starting. You got 2 of them of the 10 in, oh no, 3, because Jen was on here too, of like maybe the 10 attendings around the country. And so we're working at changing our whole culture in general so that this becomes the regular speak in terms of treating the whole patient. But we may, if you don't mind, we might be maybe even messaging this group, you particularly too, to look this over, because we also want to empower our patients to be able to have the tools maybe where they didn't, to sort of access these things while we work on our whole culture.
Well, I'd be happy to help in any way. And just here in my small town of Edmonton, or city of Edmonton, we're actually putting together our NEO guidebook. And it's that whole journey, but it's a patient-centric in conjunction with our clinical group. We're actually doing it together. And I would just love to see, you know, pieces of this brought to the fore. So if I can influence, you know, any of these pieces going forward, I'd be happy to help.
I just got to find a way. COVID's got to slow down so I can have Sanjay back,
Yeah.
since he was basically pulled for COVID care.
Yeah. Well, thank you. Thank you again.
keep my fingers crossed.
Yeah, speaking of which, I wasn't supposed to be working this week very much, but we've had people out sick too. So